Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, we're back with our weekly guests here, and you heard Dr. Robert Amore, and you heard Rick Pepe. They're both with it's the Amore anti-aging. But it's funny about anti-aging. We nobody wants to age, right? So the anti-aging, maybe you should say aging better, aging well, right? What do you think?
Maybe we should just say regenerative medicine.
Right, yeah, regenerative medicine, right, exactly.
A better you.
A better you.
A better you. Yeah, that's good. That's what it's all about, actually. So we have you, and every week when you come on, you must have interesting stories about helping people and what happens. And we decided we were going to do things again on stem cell because it seems that's the hottest issue. Mm-hmm. I think what was it we talked about last time? 10 years ago, stem cells, they were this mysterious thing, but you've really gotten it down now where it's perfect, I think. I mean, it isn't like, woo-woo, stuff, because you had great results. Why don't you tell us, Dr. Amore, what are some of the great results with stem cells?
Well, with some of the stem cells today, the way it is done today, the people are doing so much better when it comes to joint injuries and tissue injuries. The stem cells will help speed up recovery and heal those injuries, whereas years ago we didn't have that possibility, so it was more of a longer time waiting to heal, possible not healing as well. And so today is a much better arena, I guess, or right now with the way things are with stem cells, and we're on the cutting edge with all this technology that where the tissue is healing much quicker and faster and better than it would have years ago without stem cells. So I think this is what we're finding in our office a lot, and we're finding people are coming back for more things, different things they want to do. Instead of, say they had a knee joint injury, now they want, hey, I want to get my face done, or I want to get, my other hip, or I want to get this, or whatever, because they're starting to see how well it's doing, and less downtime for them, and they just feel, this is worth it. Why should I go through that process of surgery, possible infection, possible 6 months to a year recovery? I mean, I don't have to do that anymore.
So Rick Pepe, as the education counselor there, at the Amore Regenerative Medicine Center, how do you know to refer them to stem cell? I mean, maybe they don't need stem cells. Maybe they just need, a hug and a kiss from Dr. Amore.
We had some patients like that. Believe it or not, we have. That the biggest thing is being honest. At the end of the day, if the person actually needs it or the person does not need it, they need other therapies. But majority of the people that have seen us so far have needed the stem cell. Majority they have. Okay,
so if they come in, do you have certain things that you say? Why don't you maybe I've just walked in. Let's just do this as a little play game here.
Well, we'll give you
Hi, I'm ANITA FINLEY, and this looks like a great center, and you're so attractive. What am I going to have here?
Okay, nice to meet you, Anita. We do offer, stem cells. We offer at our clinic also PRP, facial rejuvenation, hair regeneration. We offer chiropractic massage therapy. We offer, physical therapy. So we do offer a lot of other things in our clinic. But like I said, like you said in the beginning of the show, was that the hottest thing right now is the stem cell. People are calling in. They want to know more about the stem cells. There's a few people already came in from the show already that already had the stem cell done.
They already had it done?
Correct.
And tell me about that. So what happened?
They called, obviously. They made an appointment to come in. Basically, he came in. He had 2 bad knees, this particular gentleman. And I told them all about the stem cells. They wanted to do the stem cell that day. So I said, no, unfortunately, there's a protocol for everything. So we got his blood work. We set him up for the following week to have the stem cells done, and he did phenomenal. It was this past weekend.
So, okay, so Dr. Amore, now now Rick gives them all the pizzazz. Then you walk in, and then what do you do?
Well, I always try to, talk to the patients and find out what they've had done previously. So I want to know, the past. I want to know what's going on. Why are you having these problems? Why all of a sudden you want to do stem cells? Have you tried all these other options first? I always like to rule out things first and make sure they've gone through all that process of, whether it be physical therapy, whether it be, other types of treatments, this and that. Because really, at the end of the day, if some people can get better just by going through physical therapy and strengthening muscles, it could be something really not as severe as what, a lot of
Will you
people
do physical therapy
we
there?
do physical therapy. We do a lot of different things. So, rehab therapy. So we'll check and see if there's an osteoarthritic condition or if there's some other type of condition. We'll see what it is. We'll find out from their history how long they had it for, what they've done in the past, who they've been to. Okay, it hasn't been working. Okay, this is where you want to go. But stem cells would be, a great jump. You can get right into stem cells, and it works very well, very quickly. And this is what's happening today: is you're getting a lot of people that are coming in that, hey, I don't want to waste my time with this. I know this is going to work. Let me do this. I said, well, let's just rule out a few things first. But what we generally do is, if we do the stem cells, we also get them into a rehab program later on after they go through a certain process. With the stem cells, they'll also strengthen some muscles. So it's important to kind of like do that holistic approach and look at that whole thing when you're dealing with people that have certain problems,
I see. So this isn't, as you said, they come in, Rick gets them excited, they come into you, and it's let's get on the table, let's do it, right?
Yeah.
No.
It's again, you have to go through labs. You have to do your due diligence first before you start doing certain things. You really need to understand that patient, what's going on with that patient, and what they need exactly. They might want these things, and I get it, but I'll explain it. Rick will explain exactly what you're getting, how long it's going to take to recover, the process of everything. They need to understand that first before they, they're very excited about it, but I want them to understand it also, that there's no questions later like, you didn't tell me it was going to take me, 3 months or this or whatever, because some things take time to regenerate. You have to set the tone. You got to set it up. So.
Well, explain, Rick, maybe you can explain something to me here. I know Dr. Amore can, but when that stem cell is put in there, do you feel anything? I mean, is it like growing? Or, how do you know that it's working?
Over a period of time, the first thing that most patients feel is usually feel less pain. That's the biggest thing. They start feeling less pain. Their mobility starts to get a little bit better. And over time, they realize they're starting to walk a little bit straighter, or they have better, range of motion. So it's like he said, it's a process that does take time. And there's the biggest thing with this particular procedure, there's no downtime. There's no surgical trauma to the patient, okay? There's no fear of infection. That's the biggest thing.
Well, let's see. We have Scott Norwood on here, and we have another gentleman watching, and Chuck Montgomery. I know these are wonderful people who are interested in this. And so what I think I'm going to do at this time, if you would like to be able to talk to either Robert or to Rick, you would call them, and I'll give you the number. Remember, this Pencil Talk Radio, so get your pencils out. And it's 954-755-0224. Again, 755-0224. That's 954. You can go on their website also, which is Amore, A-M-O-R-E, antiaging.com. And you can see more about this. So, following along with this, when you finish them, I don't know, does it take an hour, 2 hours, or then do they go home? Do they have to go to bed?
An hour.
Yeah, it depends on, the knees they're not long procedures. Unless you're doing facial rejuvenation or hair restoration, those take longer. There's a lot more involved. But knee, anything into the joints, it's an injection. So it's prepping, which doesn't take, 15 minutes or so, and then injecting using a diagnostic ultrasound, a guided ultrasound to see where the needle goes, and you inject into that area, and you're done.
Well, now you have a great head of hair, so you're not going to need it. You have very, very nice,
Thanks.
gorgeous hair.
Thanks,
Okay, so a man comes in. Is it mostly men who are looking for the hair replacement? I would
Actually, believe it or not,
Oh.
no. I mean, believe it or not, no. I've had women. I had my next door neighbor call, say, hey, listen, my hair's thin, that's why I wear a hat. I said, well.
I love it.
I said, okay, well.
So tell me what you had to do. Explain that whole thing, because I can't picture what you do to make hair grow on a head.
With hair, again, we utilize a couple ways you do it. You can do it straight PRP, or you can add stem cells with it. So that's number one. It's generally in threes. So the first time you do it, okay, that's the first time. Then 4 weeks out, you do it again, and then 4 weeks out, you do it again, and then you're done. So what they do is generally they go ahead and they use microneedling. First, we have to numb your head, all right, with this solution, and you have to sit for about 45 minutes before we can start the process. So there's the time allotment there, and then you use microneedling, and you start kind of like irrigating, so to speak, the scalp, and you start getting the PRP. Say we use the PRP first, and we inject the PRP into each follicle. Each area, so it takes time. You go down a row, you go down a row, you go down a row, you go down a row. It takes time, right?
So you're actually putting a little needle in there.
Yeah,
Does it hurt?
you're going in.
No, because you've numbed the whole.
Well, you numb it and they don't feel it, and it doesn't go deep. It's
Uh-huh.
short, And so you're doing a row.
Okay.
You're seating. You're basically seating.
Okay.
And then you do that, and 4 weeks later you have them come back. And
Are there little fuzz starts to happen?
well,
What
it
happens?
generally takes a little longer than 4 weeks, but it starts. You're planting the seed. It generally takes long. With the hair, you're talking, 3 to 6 months is where you're looking.
But
for.
okay, so let's say even 6 months. All of a sudden, you're seeing hair where there was no hair
Yes.
before.
Yes.
I
Correct.
can't even. This is hard
Yeah.
to believe, isn't it?
So it's
And
pretty
so
cool.
the guys who are wearing toupees, or the women who are wearing wigs, you're telling me that in a year, let's say in a year,
yeah.
and now how often do you have to do this? Every
no,
week?
You do this. We split it over 3 times, so every 4 weeks, so 12 weeks total.
12 weeks. And after 12 weeks,
You leave 'em alone.
people will have their hair.
They'll start.
Not the whole hair,
no,
just
but
little
things will
bits.
start, moving.
And then it continues to grow without your doing
Right.
anything more.
Right.
You've done it.
Because if you've added stem cells, they produce the ability to grow those hair follicles again. PRP also triggers that. So they're both doing that. So now we want them to grow on their own. And then we'll give them some other things they can put on their scalp to take home with them that helps, when they go to sleep at night. And you're basically setting up the area to produce or grow or generate. That's what you're trying to do. And that's
So
what it
do
does.
you have pictures of before and afters?
I don't with me.
No, but you do. If I
Yes.
got on your website, would
Yeah.
I see a before and after?
Not quite on the website. We have them at the office, but we're going to put them on the website.
Well, if you send them to me and our website, we'll put them on our website
Okay,
for you.
great. Very
Because
good.
I think there's nothing better than to see the before and after,
Oh,
isn't
it's
it?
the
Well, it's the
best.
same thing with the face too.
Yeah.
We have pictures before.
Okay, we're going to talk about the face next. Talk about the face. So, as one ages, we know we get wrinkles, we get different things, we get lines. Tell me how that works.
Well, it's similar to the scalp. Again, like you said, as we age, we start to lose our fullness. Our collagen, elastin fibers start to dissipate.
Okay.
And so this is where you get the crevices,
Right.
and the crow's feet, and all these different things. And so what's the big thing today? They go to plastic surgery or dermatologist, and they get the Botoxes and the Restylans and the Juvederms, and they're all temporary fillers. And Botox is not a filler; it's more of a numbs that area out, so you have
The
no
muscle,
more lines.
right, right.
But we're utilizing PRP and PRFM, which is a fiber matrix. It's more of a heated PRP as a filler. So you're utilizing your own blood or your own platelets, right, into your body. You're putting things that you took out of your body right back into your body, but just in a different place. Now you're putting it in there, and it's going to stimulate growth of collagen and elastin, which you've lost, because you're not getting any growth of your collagen and elastin at our age because we're older. So we're putting something young in there to start developing and growing this again. And that's what it's doing. And now you're getting full, your face is filling out again, you're losing those trophies, and it's doing it automatically. You're not doing it where you have to go every 3 months or whatever it is with fillers, Juvederm and Restylane and Botox. So now your body's going to start doing this on its own, and this is the process. And
Now, will it last though?
Well, the facelift will last anywhere from 18 to 24 months, which is much longer than the conventional other Juvederms.
So in other words, it knows where to go to
Yes.
to make it look
Well,
like a baby.
they'll microneedle and they'll inject in these areas too. Again, so it's
right.
they've called it the vampire lift. They've called it the bloody
I know,
whatever.
I've heard
They
that.
got
I
a lot
hate
of
the
names for it.
vampire.
Yeah, but it's basically microneedling and hitting areas that are the areas that you need to hit, and it'll start you put the filler in there, and you put the PRP or you put some stem cell, and it starts growing on its own. That's what you want. You want your collagen and elastin to start producing.
You're listening to Robert Amore, who is the owner-founder, of the Amore Degenerative Medicine. What's really Amore Anti-Aging? That's what we're calling a lot of things. Regenerating everything, right? Do we get to regenerate our brain too? Oh no! Don't start. Did I
coming.
ask a bad thing?
No, things are coming. I mean,
Really?
The biggest thing as we get older, we are not as sharp. We forget. We can't.
That's a good thing.
Yeah.
Sometimes.
So but you want to
No,
be
I'm
sharp
kidding.
in this age
Of course.
today. You have Rick will tell you vitamins. Ginkgo biloba is one of the big ones for memory.
What is that?
Ginkgo biloba is a
that's
big
right.
memory
So
one.
yeah, but that's not what you're doing.
No, we're trying to generate cells to start to
To
regenerate certain areas of the brain. So you go in a whole nother area there, but that's a little bit more advanced right now. And they're working on a lot of different things. But I think that's going to come eventually.
Okay, so now we've talked a little bit about hair. I know in your marketing you talk about facial and hair restoration, and you have pictures, and we're going to get them to me so I can literally before and after.
Yep.
And you're saying that probably it's a 6 month, maybe to a year, but you don't go every day. I mean, you don't go every week. How often for this type of thing do you have to go? You said 3 or 4 times.
Yeah, you do it in 3
Every 4
times.
weeks.
Yeah, every 4 weeks, and you're pretty much done. You can
3 times.
Amazing.
Yeah.
And you're going to walk. Then you're going to. But you're not feeling anything. You can sleep. I mean, when these are in you, are your face burning? Do you feel things?
No, I'll give you the facial is like you had a suntan or sunburn, and it's tighter. Your face will feel tight right after you're
That's
done.
good.
Right, and it's kind of like a little light burn type of
see.
thing, and it'll last about 24 to 48 hours, and that's it, and then you're back to normal. You can't put makeup on after you do this. You gotta
Get very red.
Yeah,
It gets red.
some get red.
Like a
It gets red. It's like a
suntan.
summer. Yeah.
And then it just goes along its way.
Yeah.
And so do you have to have like an antibiotic when you're doing this? You don't have anything like that.
No
Because it's
anti-inflammatories.
also, and you're
no
in such a
anti-
pure environment. You've talked to me about that.
Yeah. And you don't want to add any type of anti-inflammatories. You want the body to do itself. That's the response you're trying to create. You're trying to create an inflammation process so that the body starts working to heal.
Okay, so Dr. D'Amore, I got to ask you, why did you decide? Here you're a great chiropractor. This is what you've been doing a long time, and now you decide to get into something else. Why is that?
Well, I think that in any business, it doesn't matter if you're a chiropractor, medical, whatever, orthopedic. You're always looking to help people. You're always looking for change. You're always looking for the new things that are coming out that people may be interested in. And I like to help people, and I'm always looking for things that people may want to have. So this is one of the aspects that I find, this is actually, when you think about it, it's better to have this than to go for surgery or go for, plastic surgery. There's a lot of plastic surgeons out there, but they have to cut, and they do, there's possible infection with any type of surgery.
There's a lot of pain with
a lot
all
of pain,
that too,
a lot
right?
of
You're not going to do the
yeah.
pain.
So I think this is kind of up our alley, and it's kind of related to wellness and health, and so without all that extra surgery and possibility of infection. So that's
Okay, so Rick, you've been listening to Dr. D'Amore. I guess you sit there in amazement, don't you? I know you talk to people about the marketing, but even though you're doing that, I guess you're still amazed at what it does, aren't you?
Absolutely. I mean, it's cutting edge stuff. I mean, for
Without
myself, I'm sorry.
Without cutting.
Without cutting, without causing any trauma to the system. And people today, people want, they don't want any downtime. People are always on the go today. So a procedure like this, it's perfect for them. There's no downtime. The procedure is 90 to 95% success rate for any joint, okay? I mean, what else can you ask for? Surgery, you're only looking between 60 and 65%.
Okay, so let's say that someone comes in.
And there's more downtime. We're talking about 6 months of downtime.
You're definitely right.
And pain and inflammation and, sometimes when you're in so much pain, you get more depressed.
That's when you start on the medication.
Exactly. And that's a huge problem. Again, in this country, we're trying to get people off medications. We're trying to do, the proper thing to help people, not to, give people certain medications which deteriorate their health. And that's basically what medications do.
So if someone comes in and they have a fractured shoulder or something, can you help them?
Yeah.
You can help them with the stem cell.
Absolutely. I mean, fracture, it just depends on the severity of the fracture. Sometimes, again, he'll look at the x-rays, the other doctor will look at the x-rays, and determine, is this something we can help with? If it's something that we cannot, if it is a broken bone, then we obviously would probably refer them to an orthopedic where they would have to set the bone.
But then, after that happens,
they can come back.
They need to have physical therapy,
correct.
Right? They need
PRP will accelerate the healing process. Stem cell again will accelerate that too. So at the end of the day, they could come back and they could still do those type of therapies and expedite their healing and repairing.
But you both are so nice too. I'm sure that and I've always said this, that there are many doctors. We always called it bedside manner.
Mm-hmm.
When doctors are good, but they don't have bedside manner, they're not healing the patient as well. We know that. I can see both of you when you have someone, you encourage them, and I think that's part of the healing process, don't you?
It's
Absolutely.
a big part. It's a big part.
You want to have an environment where people come in and they enjoy coming in.
Right.
They enjoy our company.
I'm sure they do.
A lot of our patients, they love coming out. They like hanging out in the office.
Yeah, I'm sure that happens.
They hang out in the office for an hour or two.
I'm sure that happens.
Because, they love the environment,
Right. Well, you're very nice, both of you. I can see
we have
that.
a good time there. I mean, at the end of the day, that's the biggest thing. You want to have that feeling when they come in. It's a relaxed, comfortable setting.
And you have to treat patients like family.
Yeah. And I can see that. Are you Italian?
Yes.
And I can tell it. I mean, I'm sure your mother, your family members, lots of wonderful food. You don't know this, but my son married a woman from Italy. Actually, her name is Stefania Bologna.
Oh, wow.
Is that Italian?
It's Italian. It's Italian.
It sure is.
That's Italian.
And so they are, there's certain wonderful characteristics of being Italian. And is your mother still living?
Yes.
Oh my goodness, she must love you and what you're doing. Does she live here?
She lives in Connecticut. I was just there.
Oh.
She's 93.
Oh my goodness, how wonderful. Have you had to do anything for her?
Not yet, no. Knock on wood.
Oh, so she has a good, so you have great genes. When you think about it, she's 93.
93, yeah.
Oh, that sounds wonderful. Yeah. So she must be so proud of you and what you can do.
I'm sure she is. And she's just, enjoying what we're doing, Rick and I. So I think.
Oh, I'm sure that's very true, because this is, especially having both of you come on the show and share all this. There are a lot of doctors that are a lot more secretive, you know that.
Yeah.
And I don't know why they are, but with what you do, it's so open. It's like an open and shut case. Okay, you have this. We're going to go and we're going to examine, make sure that you fit it, and whether it's stem cell or PRP or whatever it is, you'll work on it. Have you ever? Are there people you turn away? Tell me what happens.
Sure, there's always going to be some people that you turn away. Some people are just maybe not right for the situation. They might feel they want something bad enough, but they don't have that condition that they need to have that certain procedure done. I've had people come in, they want both knees done. For stem cells, I said, your knees look great. I mean,
wait. Why are they doing that?
Well, they said they have pain. I said, it's not coming from your knees. It's coming from something else, so we need to look into something else.
And that's where your chiropractic profession comes in.
Which works well, because now you can work them on both sides. And you say, okay, well, listen, let's look at this. Just remember, your structure relates to your function. So if something's wrong, relates to functioning.
Your function. That's a good one.
So a lot of times people come in, and we have some young people that come in, and they don't really you take a picture of their X-rays. Oh, I have a lot of knee pain. I said, well, why you have knee pain? I don't see arthritis. I don't see decreased spacing. The joint's moving fine.
So what?
So let's find out what's going on. Well, a lot of it has to do with muscular problems or some other problems, especially if, everyone's different. It depends what they do in their life. You have to find, this is the history. This is where you need to get the history on these people. Do they have a trauma to that area? Did they have, what do they do on a regular basis? You got to find out what they're doing before you start jumping into doing something.
Before we run out of time, I have a question. Do you help people who are having core problems? And talk about core and what that is, because that's everything, isn't it?
Core is the big thing. Without strengthening your core, then the rest of your body has a problem. So, yes, we have exercises that we give patients. Actually, I have a program that I can send it right to their iPhone or their phones, and they can, or wherever their emails, and they can just play it at home and go through all the exercises, and I show them how it's done in the office, and then they go and do it at home or wherever. Yeah, so core training is very important. If you don't have a strong midsection, then we do this with people that have back pains. I said, why you have back pain? Because your core is not so good, so we need to get your core strengthened.
Okay, so it's like, all right, people, so we told you a lot. Let me give all our listeners now the phone number again to call. It's 954-755-0224. 954-755-0224. And our people who have told us on Facebook that they're there. So to request an appointment, and there's a free consultation. That's very important.
Yes.
Very important. So it's regenerative medicine, whether it's stem cell therapy, hormone replacement, platelet-rich plasma, facial and hair restoration. I love that one. Joint rejuvenation, physical therapy, massage therapy. Please do go and call them. It's voted the best regenerative medicine clinic. So thank you so much for being here again. We look forward to some more time. I'm learning so much.
Thanks.
And I think we need to get those pictures on our website, okay, so people can really see you, see what happens. Yeah. You really have a wig on, right? That's not your hair. I'm kidding. And we know about you, Rick. Forget it.
Wig on this head.
No, yeah. I like the way it is. Okay, we'll get you back again. Bye.
Thank you. Thank you very much. Bye-bye.